Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Yellow discharge and normal vaginal fluid. Yellow discharge from your vagina may be a sign your period is coming or indicate early pregnancy. It may also be simply due to the natural function of the vagina. /r/n/r/n. However, yellow discharge could indicate that you have a sexually transmitted infection, STI, or other conditions that require medical treatment. This is especially true if the discharge is dark, yellowish green, or has a foul odor. /r/n/r/n. It's important to see a healthcare provider for any unusual vaginal discharge. In addition to being a sign that you may need medical care, you could be at risk for passing an infection on to a sexual partner, and you both might need treatment. /r/n/r/n. Illustration by Joules Garcia for Verywell Health. /r/n/r/n. Discharge from the vagina is normal if it is white, transparent, and odorless. The consistency can range from thick to thin. It can also have a light yellowish hue and still be perfectly normal. /r/n/r/n. Here are two key examples. /r/n/r/n. Vaginal discharge can change due to shifting hormones. During the middle part of your menstrual cycle, the volume of vaginal fluid will increase and have an egg-white-like consistency. However, when the discharge comes into contact with air, it can undergo a process called oxidation that causes it to turn a creamy, cloudy, or light yellowish color. All of these colors are perfectly normal. /r/n/r/n. The discharge can also turn yellowish when it comes into contact with otherwise good bacteria in the vaginal flora. The color change, if any, will tend to be slight. /r/n/r/n. An increase in vaginal discharge can be an early sign of pregnancy. In pregnancy, the body prepares for birth by softening the cervix, the lower neck of the uterus that connects to the vagina, and vaginal walls. To stop infections from reaching the uterus, the body produces more discharge. /r/n/r/n. This discharge is normal and is usually clear or white. However, it can also turn yellow upon contact with the air, such as when it remains in underwear for a while. /r/n/r/n. There are other situations where a yellow vaginal discharge is not normal. In cases like this, the change in color will often be more profound, and there may also be other abnormalities in the consistency or smell of the discharge. You may experience other symptoms if the discharge is a sign of a medical problem. /r/n/r/n. Vaginitis is the term used to describe a number of conditions that can cause inflammation in the vagina. These can include infections stemming from bacteria, viruses, or yeast. /r/n/r/n. In some cases, vaginitis may be caused by an allergic reaction to products such as vaginal sprays, douches, spermicides, soaps, or laundry detergents. /r/n/r/n. Taking certain medications can also lead to vaginitis. These include antibiotics and corticosteroids. /r/n/r/n. Symptoms of vaginitis may include /r/n/r/n. The treatment of vaginitis often involves vaginal creams or suppositories that contain antibiotics, antifungals, or other agents depending on the underlying cause. /r/n/r/n. Trichomoniasis is an STI caused by a parasite. It is the most common non-viral sexually transmitted infection in the world. You may have trichomoniasis without realizing it because the infection doesn't always cause symptoms. /r/n/r/n. When there are symptoms, trichomoniasis can cause a vaginal discharge that is, /r/n/r/n. Trichomoniasis is treated with the oral antibiotic metronidazole taken twice daily for 7 days. /r/n/r/n. Chlamydia and gonorrhea are common STIs caused by different bacteria. Chlamydia is the most common bacterial STI in the United States, followed closely by gonorrhea. /r/n/r/n. Both of these STIs can cause a vaginal discharge, that is, /r/n/r/n. You may also experience pain in the lower abdomen and pain or burning while urinating. /r/n/r/n. Both chlamydia and gonorrhea are treated with antibiotics. Chlamydia can be treated with a single oral dose of azithromycin by taking doxycycline twice daily for 7 to 14 days. Gonorrhea is typically treated with a single injection of ceftriaxone. /r/n/r/n. Pelvic inflammatory disease, PID, is an infection of the reproductive organs which includes the uterus, fallopian tubes, and ovaries. The main causes of PID are STIs like chlamydia, gonorrhea, or mycoplasma genitalium. /r/n/r/n. Not everyone with PID will experience symptoms, but those who do may have. /r/n/r/n. PID is treated with a combination of antibiotics. This may include an injection of ceftriaxone accompanied by a twice-daily dose of doxycycline for 7 days. /r/n/r/n. Cervicitis is the inflammation of the cervix. It can be caused by an infection such as chlamydia, gonorrhea, and genital herpes. However, it may also be the result of non-infectious causes like contact dermatitis, autoimmune diseases, and intravaginal devices like IUDs. /r/n/r/n. Often, cervicitis will not cause any symptoms at all. When it does, there may be a persistent, abnormal vaginal discharge, that is, /r/n/r/n. The treatment of cervicitis depends on what is causing it. In cases like contact dermatitis, all that may be needed is the avoidance of irritants or allergy-causing substances. /r/n/r/n. Bacterial vaginosis, BV, occurs when the balance of microorganisms normally found in the vagina becomes disturbed, leading to irritation and inflammation. There may be no symptoms. /r/n/r/n. However, BV can cause yellowish vaginal fluid and other symptoms related to abnormal vaginal discharge, including /r/n/r/n. BV can be treated with oral metronidazole taken twice daily for 7 days, metronidazole gel applied to the vagina once daily for 5 days, or clindamycin cream applied to the vagina once nightly for 7 days. /r/n/r/n. While white or pale yellow discharge is the norm, the color of vaginal fluid can change depending on your circumstances. These ceach orange are not always a sign of a problem, but you should be aware of when some changes could indicate a problem. /r/n/r/n. While vaginal discharge that turns yellow in your underwear is nothing to worry about, there are ways to stem infections or irritants that cause abnormal yellow discharge. /r/n/r/n. Using barrier methods such as condoms during sex prevents the risks of both STIs and pregnancy. However, they must be worn correctly and consistently in order to be effective. /r/n/r/n. As effective as they are with certain STIs, condoms do not offer complete protection against syphilis, herpes, or human papillomavirus, HPV. /r/n/r/n. It is important to be honest with your partner about your own sexual history and to question them about their sexual past. /r/n/r/n. This includes /r/n/r/n. In addition, the more partners you have, the greater your risk of STIs. Even non-sexually transmitted conditions like BV are influenced by the number of sex partners you have. /r/n/r/n. Douching, the practice of irrigating the vagina with water or other solutions, is not needed. The vagina is naturally self-cleaning, and douching is not necessary. /r/n/r/n. The chemicals found in douches can be irritating to the vagina and can disrupt the normal bacteria flora. Douching can also cause infections to spread to the uterus and, in turn, increase the risk of pelvic inflammatory disease. /r/n/r/n. The smells you notice in your genital area typically come from outside of the vagina in your vulva. You can keep the vulva clean by washing it with water and a gentle soap. /r/n/r/n Fragrances found in some personal care products can be irritating to the vagina and can also change the levels of healthy bacteria in your vagina. /r/n/r/n It is best to avoid fragrances found in /r/n/r/n If ever you are concerned about your vaginal health, don't hesitate to speak with a healthcare provider. /r/n/r/n But you should contact a healthcare provider immediately if you experience signs of a serious infection, including /r/n/r/n This is especially true if you are pregnant. If not treated immediately, an infection like this can increase the risk of preterm birth or low birth weight. /r/n/r/n The CDC recommends that men who have sex with men, MSM, and transgender women, TGW, who are at high risk for STIs receive counseling about post-exposure prophylaxis, PEP, to prevent an infection. For instance, oral doxycycline can be taken once within 72 hours of condomless oral, anal, or vaginal sex to protect against STI. /r/n/r/n Yellow discharge can be normal and simply a sign of regular clear discharge changing color upon contact with the air. However, it may also be a sign of infections, including STIs and pelvic inflammatory disease. Yellow discharge may also be noted in early pregnancy. If you are concerned about your discharge or your health, speak with your healthcare provider. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.